further recognized later in the program. Isa sa mga naging sandigan natin sa pag-usad sa kalusugan pangkalahatan sa ating lalawigan ang ating mga pamahalaang lokal. Hindi matatawaran ang suporta ng ating mga kasama at kakampi sa isang malusog na Quezon. Please welcome ang mga kampyon ng kalusugan sa ating lungsod at kababayan, our city and municipal mayors. And we are also graced by the presence of our local legislative counterparts. A warm round of applause, please, for our city and municipal vice mayors and members of the Sanggunian. One of the biggest challenges that we are facing is the improvement of our hospital systems. This year, we have recognized the hospital operations to strengthen our systems in the 15 provincial hospitals. Welcome to our chiefs of hospitals from the Quezon Provincial Hospital Network. Attaining universal healthcare in the province of Quezon remains to be an uphill battle, especially in the grassroots. Tonight, we will recognize the most important roles and accomplishments of our public health workers. Ang mga bayani po natin sa laylayan, our frontliners, headed by our city and municipal health officers, public health nurses, and other staff. Let's give a round of applause to our city and municipal health officers. And finally, we also welcome our host and the punong abala for tonight's event, and actually for the entire year, in making sure that the provincial health system will be functional and will move forward towards our goal of kalusugang pangkalahatan. Headed by our Provincial Health Officer to Dr. Christine May Jean Villaseñor. Our colleagues from the Provincial Health Office, of course. Well, ladies and gentlemen, tonight is a celebration of our hard work towards the attainment of universal healthcare in our dear province of Quezon. Tunay nga namang nagniningning ang kalangitan kasama ang kanyang mga bituin. Well, Helen Keller once said, "Alone, we can do so little. But together, we can do so much." At katulad nito, ang kalusugang pangkalahatan ay magiging produkto lamang ng sama-sama nating paghakbang, sabay-sabay at kapit-kamay na pagsulong para sa serbisyong kalusugan na ramdam nino man. Serbisyong walang maiiwanan, ang kalusugang para sa lahat sa pamamagitan ng malusog na pagbabago ay ating aabutin kasama kayong lahat. Well, ladies and gentlemen, at this point, we want to take you back to this year of universal healthcare. Put your eyes on the board. Let's all watch this audiovisual presentation.
We resolve to do more good to our people. We hope for the best. And the best is yet to come. Mga kaprobinsya, malayo pa tayo. Pero, malayo na tayo.
Hindi ako tumitingin sa kakulangan. Kung anong meron at kung anong kayang gayin, so kung anong meron tayo.
Ladies and gentlemen, announcing the arrival of Honorable Senator Amy Romualdez Marcos. Please all rise and give her a round of applause.
Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon.
And you may now be seated. Just a practice, guys. And of course, we would like to recognize the presence of Mayor Rachel A. Ubana. And thank you, Mayor, for gracing us with your presence tonight. And mga kaibigan, what we've witnessed, what we've watched earlier on the big screen is our year in universal healthcare. Truly, everyone has worked hard for us to be standing at where we are right now. And stick around because later on, mga kaibigan, one of the highlights of tonight's event is the recognizing the men and women who have worked or who have been working tirelessly for the community and for the nation as a whole. And because you are all look ravishing and stunning tonight, we have our official photographers and videographers who are taking photos and videos. So please, if you want to check out all the photos and videos taken today, you may check our official online platforms. And of course, once again, for those who have just arrived, we want to welcome everyone to the Quezon Health Summit 2023. And again, we are very much grateful for the presence of Senator because she is a very vital part, and we consider her as country's health and nutrition champions. We are so blessed because Quezon's beloved, ever formidable, is here or will be here with us tonight, of course. gentlemen, please all rise as we welcome Honorable Senator Amy Romualdez Marcos.
Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Hashtag ay may solusyon. Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Hashtag ay may solusyon.
Honorable Senator Amy Romualdez Marcos.
Presidential daughter at siya ang kauna-unahang youth leader. Noon kabataang barangay, ngayon sangguniang kabataan. Sa KB nagmula mga kilalang pangalan na ating hinahangaan sa kasalukuyan. Anak ng presidente, sa showbiz umi-enter. Hindi lang artista kundi primera klase producer. Sino bang nagpakana na walang himala? Mga klasikong pelikula at oro, plata, mata.
Sino bang nagsimula ng orig? Pinoy music, metropop, musikero binigyan ng big break.
May hugot dahil kanya pinagdaanan ang problem solving ng bagong lipunan. Ang kahirapan hindi na dapat lumala. Bawat Pilipino ay mayroong mapapala.
Lakas makaimbyan ang presyo sa pamilihan. Ang sagot dyan ay nasa kabukiran. Bigyang suporta ang mga magsasaka. Ibenta sa merkado sa murang halaga. Mga basic needs, ma-afford for more. Green revolution, we have done this before. Throwback shopping sa kadiwa. Lahat ng bilihin ay abot kaya. Maupa! Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon.
You may now all be seated.
Ugat ng problema ay bigyan ng solusyon.
Once again, welcome Honorable Senator Amy Romualdez Marcos. Thank you for gracing us with your presence tonight. At gaya po ng sinabi namin, ang buong Quezon po ay nagpapasalamat, Senator, for joining us tonight because you are one of our country's health and nutrition champions. Mahal na mahal po kayo ng lalawigan ng Quezon. Palakpakan po natin, Senator Amy. Well, ladies and gentlemen, to deliver her welcome address and the overview on the status of the Quezon province-wide health system, please welcome our Provincial Health Officer to Dr. Christine May Jean Villaseñor.
Hello. Good evening, everyone. It is my honor and privilege to have all of you here today as we gather to recognize and celebrate the outstanding contributions of our health workers, local government leaders, and development partners in promoting the health and well-being of our beloved Quezonians. Let me first recognize the presence of the principal author and the reason why we are advancing in universal healthcare implementation, none other than our very own Governor, Dr. Helen Tan. Of course, our efficient legislator, Vice Governor, 3rd Alcala and Health Committee Chair, Board Member JJ Akivido. We also have our active members of the Provincial Health Board. We have Mayor Rachel Ubana, the President of the LMP Quezon. Dr. Juvie Pasporino of Quezon PIO, Dr. Ronald Mararak, the President of Quezon AMHO. Together with our provincial leaders, the core members of the Provincial Health Board, and of course my provincial health team, we are very happy to welcome our distinguished guest. First of all, our guest of honor, Senator Amy Marcos. We also have DOH Undersecretary Francie Laksamana. We also have Assistant Regional Director Leda Hernandez. Maraming salamat po sa pagpunta ninyo sa aming Health Summit. To the municipal mayors, vice mayors, municipal councilors, municipal and city health officers, public health nurses, other LGU and RHU staff, please stand as I call your municipality for you to be recognized. Let's start with Agdangan, headed by Mayor Radam P. Aguilar. Alabat, headed by Mayor Jose Ramil Arquiza. Atimonan, headed by Mayor Rustico Joven Mendoza. Buena Vista, headed by Mayor Reynaldo Rosilia Jr. Bordeos, headed by Mayor Freddy Aman. Calawag, headed by Mayor Rosalina Visorde. Candelaria, headed by Mayor George Swayan. Catanawan, headed by Mayor Ramon Orfanel. Dolores, headed by Mayor Orlan A. Calayag. General Luna, headed by Mayor Matt Erwin V. Florido. General Nakar, headed by Mayor Eliseo Rizal. Ginyangan, headed by Mayor Maria Mariden Isaac. Gumaca, headed by Mayor Webster Letargo. Infanta, headed by Mayor Filipina Grace America. Homalig, headed by Mayor Nelmar T. Sarmiento. Lopez, headed by Mayor Rachel Ubana. Lukban, headed by Mayor Agustin Villaverde. Macalelon, headed by Mayor Artemio Mamburao. Mauban, headed by Mayor Bautista Erwin Dwight Pastrana. Pitogo, headed by Mayor Dexter Sayat. Plaridel, headed by Mayor Jose D. Saavedra. Polillo, headed by Mayor Angelique Bosque. Quezon, headed by Mayor Juan Escolano. Real, headed by Mayor Diana Abigail Aquino. Sampaloc, headed by Mayor Noel Angelo T. De Vanadera. Mulanay, headed by Mayor Aristotel L. Aguirre. Padre Burgos, headed by Mayor Ruben Uy Jokno. Pagbilao, headed by Mayor Angelica Tatlonghari. Panukulan, headed by Mayor Alfred Rigor S. Mitra. Patnanungan, headed by Mayor Marie Claire Larita. Pagkawayan, headed by Mayor Luis Oscar Eliazar. Perez, headed by Mayor Charis Marie Escalona. Chaong, headed by Mayor Vincent R.J. Mea. Unisan, headed by Mayor Ferdinand P. Adulta. Tayaba City, headed by Mayor Maria Lourdes Ponchoso. San Andres, headed by Mayor Ralph Edward Lim. San Antonio, headed by Mayor Añano Ariel Wagan. San Francisco, headed by Mayor Romulo Edaño. San Narciso, headed by Mayor Florabel Yap. And Sariaya, headed by Mayor Marcelo Galleta. Ganyan po kadami ang mga bayan sa lalawigan ng Quezon na nagtutulong-tulong para sa aming province-wide health system. Let me also recognize the second level of our healthcare provider network, the Quezon Provincial Hospital Network Chief of Hospitals. We have here Dr. Sunny Ching of QPHN Alabat and Doña Marta Atimonan. Dr. John Loria of Candelaria, Dr. Rosaline Ohastro of Bundok Peninsula, Catanawan, Dr. Annabel Argente of Guinyangan, Dr. Maria Victoria Veloso of Gumaca, Dr. Corazon de los Reyes of Claro M. Recto Infanta, Dr. Wilson Rivera of Magsaysay, Lopez, Dr. Juan Eugenio Fidel Villanueva of QPHN Quezon Medical Center, Dr. Edwin Aguirre of Mauban, Dr. Jolly Grace Santa Lucia of Polillo, Dr. Raymond Sugay of Sampaloc, Dr. Jesus Calayag of Unisan, Dr. Francis Escandor of San Francisco, and Dr. Charlie Aban of San Narciso. Medyo marami po. Gusto kong batiin lahat dahil napaka-meaningful ng inyong mga contributions sa ating lalawigan. We also have here our development partners. We have Mr. Axel Aterado of Reach Health. We also have Mr. Jomar Escat of Colgate Professional Oral Care. We have Mr. Rolando Atenante of Relief International. Dr. Marian Calnan of USAID TB Platforms Project. We also have here Dr. Maria Victoria Rondaris, our partner from Fred Hollows Foundation. We also have Dr. John Marie Sandoval and Dr. Eva Rose Lapitan from Batangas Medical Center. We also have Dr. Alan Troy Bakir from East Avenue Medical Center. Dr. Ingrid Magnata of Jepaigo. And Dr. Francisco Rivera IV from Rizal Medical Center. Maraming salamat po sa inyong pagdating sa pagtitipong ito. At this point, let me highlight the local health system's maturity level status of our province. This is our collective efforts. Please flash the slide. For the information of everybody, this maturity level is measured per key result area based on health systems building block. We have the unified governance. Next slide, please. The strategic and investment planning, financial management, human resources for health management and development, information management system, epidemiology and surveillance system, procurement and supply chain management, the referral system, the disaster risk reduction management in health, and health promotion program and campaigns. Looking at the slides, you will notice so many red in 2021. But I would like you to focus on the present year's achievement, shaded in green. Today, in the pursuit of the UHE objectives, the province of Quezon, under the stewardship of Governor Helen Tan as its first female chief executive and probably the first medical doctor to serve as governor, we have transitioned from being slow-moving to the fastest province to fully implement a province-wide health system. So guys, whenever I'm asked what the key is to achieve almost all the key result areas, my simple answer is leadership and governance. But it has to be coupled with a compassionate and empathic heart, especially for the less fortunate Quezonians. And this is evident to our governor, to our mayors, to our provincial and municipal legislators, our doctors, nurses, allied medical professionals, the barangay health workers, our nutrition scholars, and other support staff. We've also unlocked other doors through the more complicated ways. That is through strategic thinking and management, and of course, collaboration and coalition building with the generous, the very helpful, and service-oriented government and private partners, local and international. And of course, we have our Senator Amy, we have DOH, supporting our health programs, particularly in health facilities enhancement. While we have already achieved the local health system's maturity level, I have to remind everyone we have yet to improve on the health outcomes indicators, and I believe we can do this together as a province-wide health system. In the coming weeks, we will distribute medicines, ICT equipment, and your well-deserved incentives. Together, let us build healthy and productive citizens that will make a strong and vibrant Quezon Province. Let us continue to be an instrument of the Lord in preventing diseases, saving lives, and making each life of every Quezonian worth living. Congratulations to everyone. Maraming salamat po, and welcome to our first ever Health Summit 2023 organized by the Provincial Government of Quezon. Mabuhay ang lalawigan ng Quezon.
Dr. Christine May Jean Villaseñor, ladies and gentlemen. Thank you so very much, Doctor. Our meteoric rise in UHC implementation was only possible with everyone's contribution, and of course, the guidance of the Provincial Health Office. Well, I guess she deserves this once again. A round of applause for our Provincial Health Officer to Dr. Christine May Jean Villaseñor. Well, friends, the most critical initial step in attaining UHC was to get the support of our local chief executives. It was a challenge convincing our mayors to join in. But nevertheless, we were blessed and grateful to get the commitment of our 39 city and municipal mayors for province-wide health system integration. To share her experience as a local chief executive in the implementation of universal healthcare, please welcome the President of the League of Municipalities of the Philippines, Quezon Chapter, Mayor Rachel A. Ubana.
Thank you so much, sir. Malusog na gabi po sa ating lahat. Senator Amy Marcos, our dear Governor Dr. Helen Tan, Vice Governor Anacleto Alcala III, board members present, guests from Department of Health and other guests, ASEC Laksamana, ARD Dr. Leda Hernandez, other provincial officials present, our PHO, Dr. Christine Villaseñor, MHOs, Chief of Hospitals, members of the Provincial Health Board, fellow mayors, good evening. First of all, allow me to thank our dear Governor for giving me this opportunity to speak in front of you tonight. During this health summit, on behalf of the municipal mayors of Quezon, we are hoping that this forum will indeed enable the local chief executives and all stakeholders to have better understanding of the health situation in our province and appreciate what the provincial government has done to improve health services and programs, and that may this summit also serves as venue for coming up with possible necessary interventions, programs, and policies for all LGUs in the province of Quezon for us to be able to attain our provincial goal of having malulusog na mamamayang Quezonian. Allow me to start my message to all of you tonight by mentioning what everyone already knows, that health is the core of every program of any government. In fact, I know that in every Quezonian's dream is the desire to live a long, prosperous, and healthy life. Good health, therefore, is the essence that fuels the Quezonian dream, whatever it may be. Without good health, all our other dreams and efforts will only fail. The dream of every local government unit is to be able to provide its constituents the realization of their most cherished dream. Yun na nga po, we want to provide them with the best services so that they can have the best of health. Ito din po ang dahilan kung bakit ang serbisyong pangkalusugan ang palaging sentro ng mga programa ng mga pamahalaang lokal. Dahil a sick farmer cannot plow the field and plant. A sick fisherman cannot go out to sea and catch fish. No? A sick teacher cannot go to school and teach. And a sick mind cannot be productive, and a sick mayor cannot function well. And tonight, I'm kinda sick. In short, everyone needs to be healthy first before everything else can be accomplished. So allow me to share with you, sabi nga, bawal, let us put the past behind, pero allow me to share with you tonight a little bit lang of what is it, how is it in the past, no? From the point of view of mayor, allow me to share a little bit of the health service delivery in our LGUs. It used to be the situation used to be in our LGUs, in our localities, that not all sick constituents can afford to see a doctor for consultations. That's a fact. Hindi lahat ay kayang magpatingin sa doktor at magpakonsulta. Especially kung walang nararamdaman ng aming mga kababayan, hindi na po sila pumupunta sa mga doktor. Remote areas are seldom visited by doctors also. Dahil nga kakaunti ang ating mga doktor at mahirap minsan ang mga daan, hindi po nabibisita ang mga remote towns at remote barangays sa ating probinsya. Not all health services are accessible to constituents. Hindi lahat ay accessible sa kanila, minsan walang gamot, minsan na nga po walang doktor. And ito po ang palaging nakasanayan naman na po talaga namin. Kapag may sakit ang ating mga kababayan, pagkatapos po nilang pumunta sa doktor, pumupunta po sila sa mayor upang humingi po ng financial assistance, and most likely, ang mga nahihingi nilang financial assistance ay hindi na ibibili sa mga pangangailangan nilang pang-medikal, kundi nagagamit din sa iba pa po nilang pangangailangan. Membership in PhilHealth is also not available to everyone. Ito yung dating scenario na until now ay meron pa rin naman, pero it's improving na rin naman po ito. PhilHealth coverage is also limited. Referral to and from other health facilities was also a very big issue in the past. Next. At marami pa pong ibang mga scenarios na ang mga punong bayan ang nakakaalam, at they will be sharing their stories also sa ibang pagkakataon. However, in Quezon Province, I can say that we're luckier than the rest of the country with the advent of the healing agenda of our Super Healing Helen Governor. Yan po si Governor. Ang tawag ko po sa kanya ay Super Healing Helen because her healing agenda combined with the Universal Healthcare Law Because with her healing agenda and the universal healthcare law combined, we, the mayors of Quezon, know that healthcare in our province will never be the same. But our journey has just begun. Along with the, next please, allow me to share with you the initial reaction of the LGUs on the implementation of UHC in Quezon Province. Along with the improvements in health services in Quezon, brought about by Dr. Helen Tan and RA 11223, or the Universal Healthcare Law, with a beautiful promise to the Filipinos, including Quezonians. The mayors, it was difficult to convince the mayors first to integrate, and so it was also difficult to convince them to sign the MOA. It was never easy. There were a few failed attempts. I can say that the UHC implementation in Quezon, like in many other parts of the country, was met with many raised eyebrows, numerous questions. Initial reaction was apprehension and some outright refusal to join the proposed integration. It was quite challenging on the part of the provincial government and on the part of the LGUs, as it requires better understanding of the program. Many of us mayors have that notion that we will no longer have access to our own local health funds and that the decision on health projects will be made by the provincial government alone. But the provincial government has been very relentless in its pursuit to convince the mayors to give UHC a try. IECs were being done repeatedly, that sometimes we get tired of listening to lectures and attending forums, especially when it comes to the universal healthcare law. Our governor never stopped convincing and talking to us through the IPHO and explained everything to us in layman's term. In fact, let it be known by everyone that despite us mayors not yet having fully understood the UHC law, our trust in our good governor make us decide to finally embrace UHC in Quezon Province, knowing that the good governor will never recommend anything that will harm any Quezonian. And so, on April this year, all 39 LGUs of Quezon Province succumbed to the spell of Governor Helen Tan and the UHC, and finally signed the Memorandum of Agreement for integration with the provincial government, and everything was never the same. I wish to acknowledge all our local chief executives for their effort to make UHC work in the respective municipalities. At this point, may I request our mayors to please stand to be acknowledged. And so, as we implement the UHC in our province, its full effect is not yet being fully felt. But I can safely say that a big improvement in health delivery services has slowly been felt already, especially in LGUs who are already almost compliant to the requirements of the law. For instance, many of our constituents now are covered by PhilHealth. Indigent families were enrolled in PhilHealth and were given hospital benefits for free. Additional benefits, including comprehensive outpatient services, were being automatically extended to PhilHealth members. Medical consultations are now abot kamay. People do not need to be sick before they can see a doctor, even if they don't have money. Family profiling was started, and health facility options were given to families. They can now choose if they will just consult with the BHS, the RHU, or in hospitals. E-consulta package was also made available, and consultations can now be done online. With the establishment of Primary Care Provider Network, or PCPN, referral system was made easy within the province and even up to the level of apex hospitals. And what's best? Ito po yung pinakamaganda na epekto ng UHC sa mga bayan-bayan. The bigger and richer LGUs now have an opportunity to help the smaller LGUs. Nakakatulong na po ang mga malalaking bayan sa mga maliliit na bayan by sharing their shares to everyone, dahil yung kanilang health funds na dati nakukuha mula sa PhilHealth ay naiipon na sa isang pondo, and now yung mga problema ng mga maliliit na mga bayan ay pwede nang matulungan sa pamamagitan ng paggamit ng pondo mula sa ating special health funds. So salamat sa mga malalaking bayan na nakakatulong sa ating mga maliliit na bayan sa lalawigan ng Quezon. As in every new law, the UHC was met, next please, with many challenges. UHC implementation was met with many challenges, especially in its earlier phases of implementation. I will not discuss the challenges in length, as I know almost everyone here are aware of them. Allow me to mention a few though. As I mentioned earlier, UHC implementation requires comprehension and better understanding, both by the LGU and the constituents. It was quite a challenge for us, and for the constituents also, to follow. Aside from that, it also requires sound financial planning, adequate human resources for health, which we don't have, improvement of and provision of additional health facilities, especially for public hospitals and community health centers, and technical support expertise, among others. Hindi ko na po babanggitin lahat ng mga challenges at mga problema dahil baka mapagalitan po tayo ng ating governor na puro problema ang ating binabanggit. But I know everyone is well aware of the challenges, at meron naman po tayong ginagawa, meron naman ginagawa ang ating provincial government to overcome those challenges. So I will just proceed to the last part of this message, which is the hopes and dreams of mayors without consulting my fellow mayors for the universal health care and the Quezon province-wide health system. I think this is the most important para marinig po ng ating mga panauhin at ng ating minamahal na gobernador. First, we hope and we dream that all our constituents will have PhilHealth membership and coverage regardless of financial status. And fast application process. Yun ang pangarap namin, mabilis na proseso ng aplikasyon ng PhilHealth. Next, that the local health institutions will be augmented through, hindi na po napakita dito, physical facilities like super health centers, which may mga munisipyo na po na merong mga super health centers, and licensed as primary care facilities. Health workers capacitated to promote healthy lifestyle and living in healthy environment through all walks of life. Health data are easily accessible through province-wide electronic information system. Another one is the established and institutionalized DRRMH, or Disaster Risk Reduction Management System for Health. and the established epidemiological surveillance system to readily identify infectious or contagious diseases to counteract and manage to counter and manage its spread. And number 3, and the most important, is that we hope, our dear Governor, that the submitted local investment plan for health of each municipality will be adequately financed and accomplished through the help of the Provincial Special Health Fund under the Universal Health Care. Kapag nagkakasakit ang ating mga mamamayan, doktor po ang kanilang unang hinahanap. Pero babalik at babalik din po yan sa mga lingkod bayan, katulad ng mga punong bayan, para sa iba pang mga pangailangang pangkalusugan. Pangarap namin na mga punong bayan ng lalawigan ng Quezon na kapag nakapasok na sa isang health facility, ang aming mga mamamayan ay di na niya kailangang lumabas upang maghagilap ng tulong kanino man dahil abot kamay na niya ang lahat ng pwedeng tulong na makukuha mula sa pamahalaan sa pamamagitan ng universal health care. To end this message, and having said all that, having mentioned the pros and cons, and hoping that all goes well as planned, guided by the mutual support between the provincial government and the LGUs, we believe that in no time, all necessary health services can be easily available, accessible and affordable to our constituents. And we can finally say, in Quezon, sa kalusugan, kasama kami lahat. As President of the League of Mayors of Quezon Province, we assure the current provincial leaders, headed by our good Governor, Dr. Angelina Helen Tan, and the forerunners of UHC, that you have our complete support for the successful implementation of UHC in the province of Quezon. The time is now, and we need all hands on deck, so help us God. Thank you.
Mayor Rachel Ubana, mga kaibigan. Mayor, please remain on stage. May we invite you back on stage, please, because the province of Quezon would like to award the Certificate of Appreciation to Honorable Rachel A. Ubana, President of the LMP Quezon Chapter and Mayor of Lopez, Quezon, for her support to the conduct of the Quezon Health Summit 2023 Kalusugan Kasama ang Lahat. Having served as presenter of the session Reframing Perspectives for Local Government Units on UHC Implementation, discussing the vital role of our component local government units in the attainment of universal healthcare in the province of Quezon. Signed by our Provincial Governor, Dr. Helen Tan. Mayor Rachel Ubana, mga kaibigan. Mayor, maraming salamat. Napakaganda po ng inyong sinabi na ang mga Quezonian hindi na kailangang lumayo at lumabas ng Quezon. Dahil sa Quezon, lahat meron. Well, mga kaibigan, we have been very blessed to have with us one of the country's champions in pushing for reforms in the health and nutrition sector. To introduce our summit keynote speaker, please welcome our Provincial Health Officer, One for Health Service Delivery, Dr. Lorelie G. Salonga.
Thank you so much. To our dear Governor, Honorable Angelina Dr. Helen Tan, our Vice Governor, Anacleto III Alcala, to the members of the Sangguniang Panlalawigan, our local chief executives, headed by our very own Honorable Rachel Ubana, our municipal and city health officers, our developmental partners in health, both in the government and non-government agencies, our guests from the Department of Health, our colleagues in the Provincial Health Office, dear guests and esteemed awardees and participants, ladies and gentlemen, good evening and welcome again to this Quezon Health Summit 2023. It is my honor to introduce an esteemed guest who will be delivering our keynote address. She is a visionary leader, an advocate for transformative change, and a luminary in the health and wellness. She has decades of local governance and creativity under her belt that have molded her own distinct brand of proactive and innovative leadership. The remarkable achievements in the long lists of her resume makes her one of the most colorful personalities in the country. She came from the ranks as chair of Kabataang Barangay during her youth that provided platform and opportunities for young Filipinos engaging in nation building. She ran and was elected Congresswoman in the 2nd District of Ilocos Norte, serving 3 terms, authoring and co-authoring bills primarily focused on women, overseas Filipino workers, and the youth sector. She became a governor afterwards, bagging a landslide victory for Ilocos Norte. She largely focused on poverty reduction through local employment and investment, promotion of tourism, and reviving the youth sector. She currently holds the position of a senator, following her vibrant tenure as governor. Her remarkable initiatives in the ongoing construction of one of the Quezon Provincial Hospital Network in Bondoc Peninsula, in cooperation with the Department of Health, Health Facility Enhancement Program, and the Department of Public Works and Highways, show her unwavering commitment to the health of our fellow Quezonians. Being one of the advocates in the passing of Magna Carta Bill for Barangay Health Workers, which was recently approved in the 3rd reading by the House of Representatives and now is being pushed in the Senate to become a law. Her famous tagline, "What has been done in Ilocos Norte for the past 9 years can be done together for the rest of the country." Hashtag, "Ay may solusyon dyan. Carry on." Now, without further ado, ladies and gentlemen, please join me in welcoming on stage a mother, a friend, an actress, a public servant, a health and woman advocate. Ladies and gentlemen, Honorable Maria Imelda Josefa Remedios Aimee Romualdez Marcos.
Maraming salamat po. Maupo po kayo. Sayang din ang magagandang gown. At least nasuot ng gabing ito. Ganyan talaga sa lokal. Nagiging promdi ka. Proudly promdi. Pero ngayong gabi, ibang-iba ang anyo ng ating mga mayor. Higit sa lahat ang gobernador ang shikang-shika. Ako'y nai-insecure, pati yung atin na mga doktora. Naglabasa ng makikintab ng damit. Deserve naman. Highly deserved. Palakpakan po natin ang ating pinakamamahal na Governor Angelina Doktora Helen Tan. Ayan. Super suki po ako at makulit ako pumunta sa BHW. Kahit kung minsan nauudlot dahil may microclimate ang probinsya ninyo. At may mga bagyo-bagyo dyan, paulan-ulan. Pero ganun pa man, sigurado akong babalik at babalik habang may AX, may buhay. Ayan. At ang ating Vice Gov, Anacleto III Alcala III. Ayan. Mga bagets, ang swerte naman ninyo. Dr. Maria Francia Misiano Laksamana, ang DOH USEC, suki ng aking anak, si GovMat. Ibang level na siya, pambagets na rin. And of course, our LMP awardee, Mayor Lichelle Ubana of Lopez sa Quezon. Congratulations on this remarkable achievement ang ating President ng LMP Quezon Chapter. At tuwan-tuwa ako na makapiling kayong lahat. Lahat ng ating mayor, labas-pasok, yung iba na traffic, katulad ko, nanggaling po ako sa Senado. And that's in Pasay. Took me 2.5 hours to get here, but I cannot miss this event. Ayan. Dr. Christine May Jean Villaseñor, Provincial Health Officer. Dr. Laurely Salonga, Provincial Health Officer, Dr. Chris Conrad Mangunay, Provincial Health Officer, Dr. Leda Hernandez, our Assistant Regional Director for the Center for Health Development for the entire Calabar Zone, Region 4A. Ayan. Sa inyong lahat, higit sa lahat ang ating mayor, na palagay ko kulang to, ng Mayor Aguilar, Mayor Kalayag, Mayor Isaac, Mayor Mitra, Mayor Larita, Mayor Escalona, Mayor Bosque, Mayor Diana Aquino, Mayor Matt Florido, Mayor Reynoso, ang ating iba't iba pang mayor na nagsidatingan pagkatapos, at yung ating various health workers, pagkarami-rami, and all our development partners. Palakpakan po natin. Dahil tuwan-tuwa po ako, makapiling kayong lahat. Aminin ko na, para sa akin noon, nung naging gobernador ako, ang pinaka-extra challenge sa akin yung healthcare. Talagang pinapilan ko na lahat. Economic development, ayan, job generation, kinaya naman. Nakapasok kami ng mga call center, kung ano-ano, ang mga Ilocanong tanyag sa pagmamigrate na iwan na sa probinsya at nagtrabaho. Nagkaroon kami ng tourism spurt, okay naman, umabot kami ng 2.5 million sa loob ng isang taon noong 2012. Subalit yung 5 hospitals namin, provincial hospitals, talagang nanatiling Mona Lisa Hospital. Hiyang-hiya po ako, they just lie there and they die there. Wala talaga. Kaya't hirap na hirap po kami. And for that reason, I was intent on coming here tonight because we need to learn from Quezon. Congratulations to this remarkable province. Parati kasing sinasabi sa Calabar Zone, nahuhuli ang Quezon. Napakayayaman ng malalaking mga lalawigan na nakapalibot sa ating lalawigang Quezon. Subalit, number 1 naman kayo sa healthcare ngayon. Yung malalaki, hindi ibig sabihin na higit na malusog, na higit na matibay o matatag, dahil talo pa rin sila ng Quezon. So it's a real joy and pride to see this remarkable pilot effort implementing as one of 5 the PhilHealth Consultasyon Sulit at Tama, ang konsulta package, as one of mere 5 LGUs for our public to access preventive care services, including free medicine and lab tests for outpatient consultations. Also, I think it's a remarkable accomplishment to have established this network among the mayors themselves of MOAs, so that a province-wide health system integration can finally take place. Ito talaga ang tunay na kalusugan na sistema that can actually provide an integrated healthcare system to continuous and integrated services to both individuals and communities. Ako'y naninindigan na ang lokal lang, ang pamahalaan lokal lang, ang makakagawa nito. Kasi kung iniiwanan natin diyan sa mga national agencies, aminin, hindi kakayanin ang kasuluk-sulukan ng ating probinsya. Ang haba-haba, ang lawak-lawak ng Quezon. Paano pa aabutin ang Bundok Peninsula, peninsula, ang mga bulubundukin, at pati yung mga barangay sa kung saan-saan. Pati na ang Pulillo Island at yung iba't ibang karatig na kaya layo-layo na. Ang lokal lang ang makakaganap niyan. Imposibleng aabutin ng ating national government. You, of course, know from ages past that I have been an advocate of the nutrition program, inherited virtually as a legacy project from my parents, from the beginning of the famous Nutriban days. And we have continued to support that with the NutriBus, and I'm very happy. I think Mayor Mea is here from Chaong, who's bought his own. Naunahan na ako at nainip na siyang kaiintay. So it's my hope that the profits of the movies we made will finally go to all of this. You're also fully aware that the PhilHealth has become extremely expensive. And I, like the mayor, aspired, like our Mayora and the entire LMP, like you mentioned, Mayor Rachel kanina, na sana aabot tayo sa panahon na 100% coverage. Kaya lang, apakabigat na ngayon. Alam natin, ang premiums lumalampas na ng 5,000. Tapos ang monthly niya, kahit subsidy pa yan, umaabot ng 2,500 kada buwan. Mabigat na siya sa LGU. Hindi talaga kakayanin. Kaya tuwan-tuwa po ako dito sa consulta package na sinasabi ninyo because we have seen models. I am one of those in the Senate who has been studying the public care system for a long, long time. Perhaps you remember long ago that my father started the original PhilHealth. Yung kauna-ong PhilHealth na Medicare ang pangalan. Dahil yung kapatid niya ang nagbuo noon, si Dr. Pacifico Marcos. So it's a subject close to our heart and one that we discussed around the kitchen table in my family because we were so worried about it. And in the end, sad to say, having gone through the budget for the past few months. Yung budget po namin, ang budget natin, actually, ang GAA 2024, pinag-uusapan na namin ng ilang buwan na. At kahit talagang pigain at talagang katakot-takot, sabi, pag maikli ang kumot, bumaluktot. Todo tumbling na to, hindi na baluktot. At talagang pagtitignan mo, yung 13 to 15 billion, which a full coverage of PhilHealth would constitute, will never be affordable, at least in the immediate future. Hindi talaga kakayanin. Kaya napakaganda ng konsulta. Kailangan lumipat tayo sa ibang pag-iisip. Ibig sabihin, I think we've been talking about curative healthcare for many, many years. Let's move, therefore, to primary curative healthcare and preventive healthcare as the most important. There are now examples, and I enjoin you to study this because you've gone so far, in Costa Rica that have been copied by Paraguay and the other Latin American countries, where they have become the top 20 performers at 1/10 of the cost of universal health care. And it is all because of their focus on preventive health care and the empowerment of the primary health care givers, the CAHA system, which allows, in fact, the BHWs or their equivalent to be much better trained and also enlisting the help of doctors, both private and public, to go around the communities and the different villages. Perhaps this is the option that we need to study, and you in Quezon are already way ahead of the curve. And you can count on my full support for the consulta and all these packages that you have pioneered, in effect, in primary health care. Secondly, of course, Alam ko na ang lalawigan ng Quezon may 15 pampublikong ospital. And always, adequate funding can never be found to sustain the hospitals, the regional health units, to have accessible, world-class services for all Quezonians. Narinig ko na may iba't ibang bill sa House for the renationalization of several government hospitals in the province. I was running 5 hospitals, talagang lunod na lunod kami sa utang. Pero 15, hindi ko ubus maisip kung paano kakayanin yan. Kaya't let us find a way to make sure that continuous funding and aid goes to these hospitals to be placed under the direct supervision and control of the DOH. At makakaasa po kayo sa suporta ko sa iba't ibang panukalang renationalization nitong mga ospital. Ang gulo nga dahil inaasahan natin dun sa Mandanas ruling, lalaki ang NTA. Ayan, no, talaga naman hinimatay na si Mayor Urbana. Talaga naman, ako talagang inaasahan ko na lalaki sana, nabawasan pa yung dating ira. Tapos, binagsakan pa tayo ng sangkatutak ng mga duties and requirements sa health at kung ano-ano pa. Kaya, nung gobernador ako, pinaglaban namin yan, akala namin lalaki, talagang nabigo pa at nabawasan pa. Samantalang napakadaming inuutos at binabagsak sa lokal. Yan ang problema natin. Talagang kailangan ayusin po natin yan dahil ang laking hassle sa ating mamamayan. Matatandaan po ninyo itong topic ng ospital, hindi ako kasing prepared ninyo, no? Talaga naman, prepared na prepared, wala akong masabi sa mga provincial health. Ang sasabihin ko na lamang matatandaan siguro ninyo na yung nanay ko ang pasimuno ng mga specialized hospital sa Pilipinas. Kaya subject close to our heart po yun. Yung lung center, yung kidney center, yung heart center higit sa lahat, at yung Philippine Children's Hospital, siya ang nagsimula pagkat nagkaroon ng survey, ano raw ang pumapatay sa Pilipino. At that time, nauna yung heart at saka yung lungs. Ang hindi niya nabuo, 2, yung trauma, orthopedic, at saka ima-modernize, tapos meron pang cancer. Yun talaga yung ambisyon niya na mabuo yun, pagkatapos yung grupong yun, i-replicate sa iba't ibang regions, at least, para may access. Pero hindi na isatupad itong tinatawag namin noon, BOPIS hospitals. Galit na galit yung nanay ko kasi parati namin, ayan na naman yung BOPIS hospital, hindi matapos-tapos. BOPIS kasi lahat ng laman loob papakialaman, di ba? May kidney, may lungs, may heart. Pinagtatawanan namin nung bata kami, biro kami ng biro. Kasi ang hirap-hirap talaga magpatayo ng ospital, hindi biro. Lahat microbial, hospital grade, surgically cleared. Nako, ang hirap-hirap. Kaya't alam ko kung paano kahirap yan. At nung panahon ng COVID, napakinabangan pa kahit bulok na, kasama nung RITM. Kaya masyadong feel namin itong issue ng ospital. At sana mabuo natin yung ospital na pilit nating ginagawa sa Bondok Peninsula District Hospital Phase 1. Kahit papano, kahit anong lupa-lupat layo, dapat may healthcare na maaasahan at affordable. Ayan, ang ating mga bills na nandyan sa Senado, nakalimutan ko na, mas alam pa ni Doktora Salonga, nataranta ako. At andito nga yung agenda ni Dr. Tan na healing, na mas kilala sa inyong probinsya kesa sa national. But I'm one of the principal authors of the recently enacted RA 11959 or the Regional Specialty Centers Act. It is my ambition, as it was my mother's, to finally bring specialty centers to every corner of the archipelago. It designates the Department of Health to establish specialty centers in every region and in GOCC specialty hospitals, prioritizing this time cancer, cardiovascular, lung, renal care, and kidney transplant, brain and spine care, trauma care, and burn care. Dahil ito ang kinakailangan ng ating bansa. Pero asahan natin na ang ginawa natin, ipaprioritize yung mga ospital na may kalapit na SUC na may med school para tuloy-tuloy ang doktor, ang pag-graduate ng doktor. We are prioritizing, of course, all those state universities and colleges affiliated with hospitals so that the constant supply of doctors, nurses, and other health workers will be provided. It is also my suggestion to DOH that in order to fast-track the specialty centers, there is no need to build new hospitals. Instead, endow LGU hospitals that need the help and endow even private clinics that need the help and have the specialization. Ganun tayo makakabilis yung existing facility, tulungan ng pamahalaan, buhusan ng pondo, tapos yung ating mga doktor na nariyan na, talagang todo-todo ang suporta. At sa ganung paraan, sa palagay ko, makakabuo tayo ng specialty centers at iba't ibang lugar. At yung mga med school, isa rin nating malaking issue dahil yung med schools talagang hindi naman karamihan. I filed the Senate Bill 1939, an act establishing a medical school in Southern Luzon State University, the main campus in Lucban, so that this will bolster the preparation for possible future pandemics and calamities so that Quezon Province will forever be provided with quality medical education and first-rate doctors who are local Quezonians. So, eto yung effort natin na talagang tuloy-tuloy at mapili na tayo sa lalong madaling panahon bilang isa sa priority areas. At yung maraming project pa rin dyan sa DOH na forever natin sinisita, na gentle nudge lang po. And I'd like to slightly poke you here on the Health Facilities Enhancement Program na pwede ba i-converge na natin sa public works dahil kinakailangan na matapos na yung sangkatutak na backlog. At yung mga white elephant, nakahiya-hiya. Kaya't let's enlist the DPWH. After all, DOH is replete with doctors but has no engineers. So let's not pretend that we have engineers and give it to the experts instead. Furthermore, the sustainability of our hospitals and the so-called RHUs, na ngayon may super RHU na. Pwede ba talaga naman tulungan natin at hindi ko maintindihan bakit ang procurement process ng DOH bagal-bagal. Bakit kaya hanggang sa dulo ng walang hanggan nag-expire ang mga micronutrients at pati na rin ang gamot? Bakit ganon? Ayun. Kaya tutukan po natin yan at palibasa nasa national ako ngayon, inaaway ko sila paminsan-minsan, pitik-pitik lang naman. So eto yung maintenance, alam natin infrastructure is delayed. Furthermore, the locals can barely afford equipment and all these other complicated medical supplies. During my term as governor, nag-effort ako dahil kulang na kulang ang budget namin na by consignment na lamang gagawin lahat ng mga equipment. Wala naman kaming pambili ng iba't ibang CT scan at kung ano-ano pa, MRI. Kaya't by consignment, pati ang mga gamot. Ginawa na namin yon. Pati yung mga ospital, in-outsource na namin. Lahat ng laundry, catering, security, outsource na lahat para hindi tayo mahirapan. So we embarked on all sorts of experiments just to make certain that health would remain a priority and accessible quality healthcare could be provided to all Ilocanos. So I think also today the digital divide, since we've all become digital, has become most pronounced in provinces such as Quezon. Isa pang challenge yan, lalo na sa lalawigan ng Quezon, pagkat napakahaba, iba't iba ang sitwasyon at ang terrain. So I think the notion of e-medicine and e-consulta becomes one of a challenge to provide Wi-Fi, internet, and all the other communications required such that we can jump into the digital age with the poor, with the marginalized, with the remote, and even the indigenous peoples up in the mountain. Ang dami ko nang sinabi, pero most of all, nais ko lamang sabihin, congratulations po sa inyong lahat. Lahat ng pagsusumikap namin sa Ilocos, wala sa kalingking na nagawa ninyo sa Quezon. Congratulations, keep up the good work. You can count on me for everything that you do so well in Quezon Province. Higit sa lahat, Merry Christmas! Puro trabaho ang sinabi ko, pero alam naman natin, sa gabing ito, mag-a-award tayo ng mahuhusay, mga tapat, at napakagagaling na mga doktor, LGU, and health workers. Congratulations to all! Merry, Merry Christmas! Thank you!
Mabuhay, Senator Amy Marcos. Senator, samahan niyo po kami rito sa entablado. So much love and support for Quezon, no? Maraming salamat. And may we now call on our Governor, Dr. Helen Tan, to award the plaque of appreciation from the provincial government of Quezon and hand in some tokens of appreciation. She will also be joined by our Vice Governor, 3rd Alcala LMP President, Mayor Ubana, and DHO, Dr. Villa Senior. Senator, maraming salamat po from the province of Quezon. Now at this point, we'd like to invite Senator to join all the guests who are here tonight. We will have a group picture, so please all rise as our photo and videographers will have that picture, of course, with our guest speaker.
Lakas makaimbyan ang presyo sa pamilihan. Ang sagot dyan ay nasa kabukiran. Bigyang suporta ang mga
So may we invite all our beloved guests to please join us here in front for a souvenir group picture with our keynote speaker for tonight's event, Senator Amy Romualdez Marcos.
abot kaya maupa. Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Hashtag ay may solusyon.
Mula sa local, umakyat sa kongreso ay may squad goals para sa mga Ilocano. Ilocos Norte, Super Brand Hall of Famer. ISO accredited na si Amy naging governor. Sa Ilocos Norte, 20 plus lang ang bigas. Ay apo! Food security ay wagas. Sa windmill, sustainable ang kuryente. Low carbon emission, hindi sa oil nakadepende. Drug-free na po buong Ilocos Norte. Kaya mga investors dito na wiwili. Sa malayo sulok ng DJ Banger ay may nagtatayo ng mga call center.
Kay Ma'am Shi ay me tourism makes life better. Kaya naman proud na proud to wear.
Alright, now let's have the next batch of guests, please.
Dahil maraming
May cruise ship dumadaong sa Curimaao. Mga turista sa IN napapawaw. Pagod pod, empanada at kapurpurawan sa San Jose. Pasapi tayo dyan. Ilocos Norte ay teleserye kapital. Sa primetime TV laging tinatanghal. Todo suporta sa production of filmmakers. May pa-party para sa headbangers.
Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Huma-hashtag ay may solusyon. Kahit single parent siya ay determinado, ay may squad goals para yan sa Senado.
Thank you so very much. And now, Senator Aimee will have the picture with the audience. So please gather.
Let's be proud and be the best. Proud and be the best. Proud and be the best. Carry nothing to stand out.
Alright guys, please gather here. Come together as we are going to have a group picture with Senator Aimee.
Carry natin ang sa ating history. Taga-ibang country, sa Pinas nagsastudy. Carry natin noon, mas carry natin ngayon. You'll never be alone. Hashtag
Alright,
I'm
may
so
we ask
sure.
once again all our guests to please join us here in front. Let's show some love. Let's come together.
Marcos, Marcos, Marcos pa rin.
Kaya mga beshing ngumiti at tumawa na. Sa bawat challenge, dapat may solution ka. Don't be a problem, be part of the solution.
Maraming salamat, Senator Aimee from the province of Quezon.
Hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Huma-hashtag ay may solusyon. Ang mga problema na hinaharap natin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Atin ngayon, ang katapat ay hashtag ay may solusyon. Ang ugat ng problema ay bigyan ng solusyon. Huma-hashtag ay may solusyon. Kahit single parent siya ay determinado, ay may squad goals para yan sa Senado. May problema, kanyang tututukan ebidensya. Well, carry natin yan. We are Filipinos, let's be proud and be the best. Proud and be the best. Proud and be the best. Carry natin to stand out from the rest. Stand out from the rest. Stand out from the rest. Oh, carry natin ang sa ating history. Taga-ibang country, sa Pinas nagsastudy. Carry natin noon mas...
Once again, thank you very much, Senator Aimee Romualdez Marcos. Palakpakan po natin. And to the rest of the guests, may we kindly ask everyone to please find your seats. And again, please make yourself comfortable as we are going to resume the program. Thank you. right, once again, may we ask all our guests to please be seated as we are gonna proceed with our program. Alright, mga kaibigan, let us not further delay the moment. At this point, we will now proceed to the session. Making local legislation work for universal healthcare. Everyone, please welcome Vice Governor Anacleto III Alcala.
Hello. Ano ba to? Hello. Yan. Okay. Magandang gabi ho. Mabilis lang po ito at alam ko po kayo ay gutom na. Yung nararamdaman nyo po, yung nararamdaman ko rin. Health Summit, paano mapangalaga ng health kung gutom? Teka lang, itong mic kasi hindi makisama. Okay. Isang malusog na gabi sa ating lahat. A pleasant evening to everyone, to Senator Amy Marcos, to our Governor, Dr. Helen Tan, Dr. Maria Francia Misiano Laksamana, ma'am, good evening. The DOH USEC of Health Special Concerns Team, Mayor Rachel Ubana, at kasama ang mga mayors. Magandang gabi. Talagang gutom na ang itsura nyo. Andyan din po ang ating Pangulo ng Vice Mayor's League, Vice Mayor L.A. Ruanto, kasama ang mga Vice Mayors. Nandyan po. Nandun na. Akala ko nasip-sip pa kayo kay Senador pa, babae. Nakita ko, may binigay kang solicitation kay Senador. Wala kang patawad. Kay Dr. Christine May Villas, Senior Provincial Health Officer, ma'am. Magandang gabi. Sa lahat po ng mga doctors and chiefs ng different district hospitals, sa lahat po ng mga kapwa ko manggagawa sa mamalampang lalawigan, hindi ko na po isa-isa lahat. Magandang gabi ho sa ating lahat. Thank you. Kala ko artista. Okay, it is my honor to be part of tonight's Quezon Health Summit as we celebrate the success of the Universal Health Care Act. This landmark legislation is worth celebrating not just for the people of Quezon Province, but for the entire Philippines. And this is made possible through the brilliant mind of our former 4th District Representative, now Governor of Quezon, no other than Governor Dr. Helen Tan. May singit ko nga lang ho pala. Kaya nga ho pala ako nandito maaga pa. Kasi we're about to celebrate yung aking anak just passed the bar exam. Ayan ho siya. Warm of applause to Attorney Alex Alcala. Inuutusan ko na ho baka pag nanumpa na, hindi ko na mautusan. Yan, kaya po magse-celebrate dapat kami ng dinner. Napaganda pa, nakalibre pa ho ako. Kuha ka lang, akong bahala. Congratulations. Siningit ko lang po siyempre, tayo stage father. Okay, you might ask, ano bang ginawa ng Vice Gov at ng Sangguniang Panlalawigan? Ba't ba ako nandito sa Health Summit? To report the accomplishment for the universal health care and briefly explain what our role is in Quezon. As provided in Section 48 of the Local Government Code, the local legislative power shall be exercised by the Sangguniang Panlalawigan as the legislative body of the provincial government. And the SB is responsible for the ordinance, resolutions, adopting the local development plan, etc., including the local investment program for health. Yung kanina pong nireport ni Mayora Rachel, ito po ay related doon. Yung pong pinasa nating resolution down the line sa mga LGUs, ito po yung pinakatrabaho ng ating Sangguniang Panlalawigan. And thus, the Sangguniang Panlalawigan holds the legislative power for the province aims to assist the provincial government with responsive legislation to assist our beloved governor in uplifting the lives of Quezonians, especially through the healing agenda. Medyo naging mahirap po ang maging makatuwang. Totoo yan, ang isang gobernadora, Dr. Helen Tan, dahil po sa kanyang sipag at masigasig na paglilingkod, kailangan sasabay po tayo sa facing ng isang Dr. Helen Tan. Dahil nung pagsimula pa lamang ho ng pag-upo namin ni Ma'am 2 years ago, ang orientation ko po from the city government, akala ko na-equipped na ako, trained na po ako. Pero iba ho pala pagka yung mas malaki ang ating lalawigan, tapos mas marami po nangangailangan. Ika nga, in an article written by Strategic Purchasing for Primary Healthcare, it was mentioned that Filipinos experience heavy financial spending for health despite the increase in life expectancy from 62 years in 1980 to 69 years in 2016 due to health awareness made by our government. Still, the cost of medical expense is not a big joke considering that more than 50% of these expenses is out of pocket. Therefore, our constitutional mandate in relation to health is clearly stated in Article 2 of our Constitution. The state shall protect and promote the right to health of the people and instill health consciousness among them. Kaya nga po, nagkaroon tayong Universal Healthcare Act, not only to provide accessible and affordable healthcare service for all Filipinos, but it is also a testament of our nation's dedication to uplift the health standards of every citizen regardless of socio-economic status. However, the success of such a monumental endeavor lies in the effective and efficient execution at the local level, where the Sangguniang Panlalawigan plays a crucial role. It is within our esteemed body that ordinances and resolutions are crafted, providing the legal framework necessary for the implementation of health programs and policies mandated by the UHC by enacting laws that align with the spirit of the universal healthcare. We, together with the executive department headed by our governor, create an environment conducive to delivery of quality health services to our constituents. On the part of Sanggunian, we were able to pass 6 provincial resolutions related to universal healthcare insofar as universal healthcare implementation is concerned. Magandang gabi nga pala kay Dr. Roy, malilimutan ko pa. Okay, allow me to enumerate ng mabilisan lamang po. First, a resolution adopting the Department of Health Promotion Framework Strategy or HPFS for 2021 to 2030, implementing the universal healthcare law in the province of Quezon. Yan po. Secondly, a resolution authorizing our governor, Dr. Helen Tan, to enter into a MOA with component municipalities and Lucena City for interlocal government units cooperation and integration of the local health system into province-wide health system in accordance with the Universal Healthcare Act. Salamat po. Then, thirdly, MOA with Apex and Referral Hospital for the formation of a service delivery design of healthcare provider network in the province of Quezon in accordance, again, with the Universal Healthcare Act. Another MOA authority given to our governor to enter and sign in behalf of the provincial government with the DOH and the Philippine Health Insurance Corporation for the integration of the local health system into province-wide health system or PWHS. And lastly, a resolution authorizing our governor to enter again into a MOA. Tinanong ko po kanina ito kay Ma'am Tin. In behalf of the provincial government of Quezon with CareSpan Asia for the launching of CareSpan Primary Care Platform to implement Universal Healthcare Consulta Program in the identified pilot municipalities of Quezon Province. This is actually an upgrade to the e-consulta. Ano po, we are trying to negotiate with a third party in the sa CARS primary care platform para mas mapabilis po yung e-consulta na ating pong ini-implementa ngayon. So thank you again po, Governor Dr. Helen Tan. Bukod pa po dito yung the recently passed resolutions na last Monday's session. So this resolution introduces a modern approach to medicine as it provides authority to our governor that will establish a platform which will provide doctors with online tools for conducting remote telemedicine visits with patients, managing in-person patient visits, and storing patient electronic record. This will provide quality health care and service and improve overall health condition of its constituents. In addition to these pieces of legislation in support of the Universal Health Care Act, the Sangguniang Pangdalawigan, having the power of the purse, controlling the allocation of resources and budgetary appropriations, proper allocation of funds to health-related initiatives ensures that the objectives of the Universal Health Care Act are not just lofty ideals, but tangible realities. It is through our budgetary decisions that the necessary infrastructure, healthcare personnel, and medical supplies are made available to our communities. Collaboration is the key to success of any comprehensive healthcare program. The Sangguniang Panlalawigan must work hand in hand with the Department of Health, local government units, and various stakeholders to create a seamless network that facilitates the efficient delivery of health service. Through partnerships and shared responsibilities, we can overcome challenges and maximize the impact of the Universal Health Care Act. So in conclusion, ladies and gentlemen, the role of the Sangguniang Panlalawigan in the implementation of UHC is indispensable as guardians of legislation, stewards of resources, and advocates for the people. We are part of the force that can transform the goals of universal health care into attainable reality for every Filipino. Let us work together tirelessly to ensure that the promise of accessible and affordable health care reaches every corner of our beloved province of Quezon. Once again, it is an honor to be a part of this momentous event. Thank you. Mabuhay po kayo at mabuhay ang lalawigan ng Quezon. Magandang gabi ho sa ating lahat.
Ladies and gentlemen, Vice Governor Anacleto Alcala III. Well, please remain on stage as we are going toward the work of our Sangguniang Panlalawigan, Panglungsod, and Sangguniang Bayan truly has been vital to our achievements as a provincial integrated health systems. The province of Quezon would like to award the Certificate of Appreciation to Honorable Anacleto Alcala III, Vice Governor, for his support to the conduct of the Quezon Health Summit 2023 Kalusugan Kasama ang Lahat. Having served as presenter of the session, Making Local Legislation Work for Universal Healthcare, a testament to significance of sensible and enabling multi-level legislation in the implementation of UHC in the province of Quezon. Signed by our Provincial Governor, Angelina Doctora Helen Tan. Once again, Vice Governor Anacleto Alcala III. At this point, ladies and gentlemen, we will be hearing a message from one of our most important partners and the country's lead in UHC implementation in the Philippines. Representing the Department of Health is a multi-background health system administrator with background in anesthesiology, health service administration, hospital administration, community health, global healthcare financing and social health insurance, and educational leadership and management. She was the Assistant Secretary of Health for Technical Services in 2016 and in the field implementation and coordination team for Luzon in 2018. In 2022, she was appointed Undersecretary of Health for Special Concerns, overseeing PITHC and the National AIDS Council, as well as the PPP for Health and Medical Tourism. Everybody, please welcome DOH Undersecretary of Health for the Special Concerns Team, Dr. Maria Francia Misiano Laksamana.
Magandang gabi po sa inyong lahat. Ako po ay nagagalak na mag-represent sa ating newly appointed Secretary of Health, Secretary Ted Herbosa. Actually po, nung kagabi, nung sinabi sa akin na ako ang magre-represent sa kanya, wala po akong alam kung ano yung i-represent ko at saan. Kaninang umaga ko lang talaga nalaman. And when I knew that this is an activity of our beloved Governor Helen Tan, sabi ko kaagad, sige, ako nang bahala. I will never say no for an invitation by a very good, a friend, a governor, a previous congressman, and of course, a nanay ng buong Quezon. So I'm this honor to be representing our Secretary of Health tonight in this very momentous event with our theme, Kalusugan, kasama ang lahat. Sabi ko ba, kasama ang lahat o para sa lahat? Parehas na lang kako yon. Of course, this is a very significant event tonight, and we acknowledge our very energetic Governor Helen Tan. I also want to acknowledge our Assistant Director of Regional Health Office Calabarzon. Andito na po, nakikita ko na po ang ating kauna-unahang Regional Hospital sa Calabarzon, ang ating Medical Director, si Dr. Monching Magnaye, sa Batangas Medical Center. Pero ngayon po may mga kapartners na po siya. Meron na po sa Quezon, meron na rin sa Cavite, at meron na rin po sa San Mateo. Dumadami na po ang ating mga regional hospitals. Of course, babatiin ko rin po ang ating Honorable John Joseph Aquevido. Nandito, ay wala po siya, no? Sangguniang Pamlalagwigan Committee on Health and Sanitation. Of course, kanina po, nagsalita rin po ang ating Quezon Chapter President, Honorable Rachel Ubana, as the League of Municipalities of the Philippines, representing Quezon. Nandito rin po ngayon ang ating mahal na Vice-Gobernador. Narinig ko po ang mga sinabi nyo, Vice Gob Alcala. Natandaan ko po yung mga sinabi nyo sa mga resolutions nyo, and I appreciate all the resolutions of moving forward the universal healthcare. And of course, yung pong ating keynote speaker, si Senator Amy Marcos. Napakaganda po ng mga sinabi niya kanina. So, marami po tayong natutuhan sa kanya. At yan po ay isa sa puso natin lahat ng mga guidance and wisdom niya sa atin. Of course, I would like also to acknowledge our mayors, our vice mayors who are here. Napakaganda po ng activity na to na mabigyan natin ng parangal through our governor, ang parangal sa ating mga local chief executives at iba pang mga bibigyan natin ng parangal ngayong gabi. Nandito rin po ang ating mga development partners. I know they are here in this table. Nandito rin po ang mga kasamahan ko sa Department of Health, ang ating DMO, ang ating DOH reps, at iba pa pong mga kasama natin na nandito po ngayong gabi. Magandang gabi and a healthy Pilipinas po for tonight. Okay? Of course, yung pong theme natin ngayon, tumatak po sa akin kanina nung binabasa ko. Babaguhin ko na po yung ibang mga sinulat nila na sasabihin ko. I will make some changes to that speech. Yung pong kalusugan kasama ang lahat. Na-struck po ako doon kasi meron din tayong tagline na, no one should be left behind. Kasama ang lahat dito sa ating kalusugan, kasama ang lahat sa universal healthcare for all, at dapat walang maiiwanan. Pagdugtong-dugtungin po natin lahat yon. Yun po ang sinasabi ng Universal Healthcare Law, na ang author po, main author po niyan, ay ang ating mahal na governor ngayon, si Governor Helen Tan. Palakpakan po natin ang ating mga sarili dito. So the journey towards kalusugan pangkalahatan or universal healthcare is long and full of challenges. Talaga po, yung lahat po ng mga sinabi ni Vice Gov kanina, very challenging po talaga ang universal healthcare. At yung pong ating mga commitments to the well-being of every individual of the province of Quezon will escalate to be also a dream of the entire country. So as we reflect on our accomplishments and milestones, ang dami na pong accomplishments ng Quezon. Kanina po, inisa-isa po ni Senator Amy ang mga accomplishments ng Quezon. Nabanggit ko nga kanina kay Gob, number 2 kayo, pero hindi, number 1 na pala sila sa local health systems maturity level. Kasi marami na kayong green. Marami na kayong green. Ang unang-una po kasi nag-commit sa UHC integration site ay Sorsogon, yung Bicol, Sorsogon, Masbate, and Catanduanes. Pero na-surpass na po ito ng Quezon. So congratulations po sa inyong lahat. So let us recognize and celebrate all your unwavering dedication to our health workers, to our local chief executives, other stakeholders, our partners, our development partners, who have been very instrumental in shaping our province-wide health system. Na-appreciate ko po yung resolution ninyo for the MOA of a province-wide health system. Thumbs up kami dyan ni Doc Monching. At hindi lang po yan para sa Apex Hospital. Kasama po dyan ang inyong mga district hospitals, ang inyong, even the city hospitals, kasama po kayong lahat doon. So palakpakan na naman po natin yan. Because from the central office point of view po, you should be very proud of yourselves. And we are also very proud of you. So since the passage of the UHC Act on 2019, the province of Quezon has been very vital in building the foundation of for the local government units to shift the local health system into efficient, integrated healthcare provider networks. Nakita ko po na sa Quezon, nag-work po ang inyong public-private partnership. Why? Ang dami po ninyong private hospitals, private clinics. Ang dami rin po ninyong government hospitals, and you are doing a lot of works in terms of networking dun po sa ating service delivery networks ninyo, which are providing people-oriented and comprehensive healthcare. Palakpakan po ninyo ulit ito kasi po, sabi nga ni Senator Amy, napakahirap ng geographical location po ng Quezon. Sabi ko nga kay Governor kanina, gusto kong puntahan ang Humalig. Ang narating ko pa lang po na pinakamalayo ay Tingloy. Nung si Doc AJ ay buhay pa, I go around the entire Quezon. Kasi po nung 6 years na ako ay Field Implementation Coordination Team ng entire Luzon, dati po kasama pang NCR sa akin. Kaya lang napapagod na po ako, NCR, give up ko. Hindi ko po mag-give up ang North, Central, and South Luzon. Kaya po yung Quezon po talaga, malapit sa akin sa puso ko dahil tama si Senator Amy, uulitin ko po yung sinabi ni Senator Amy. Sabi nila, ang hirap ng Quezon. Mahirap na nga, malayo pa. Pero when I was the FICT, Assistant Secretary for the FICT of Luzon, challenge po sa akin ng Quezon. Pero po, ayan, alam po yan ni Doc Monching. Remember Doc Monching, Dr. Aleda? I always conduct performance budget utilization review for the provinces, for the region. Every quarter po ginagawa ko po yun. At isa po sa nag-struck sa akin, bakit sinasabi nila ang Quezon Province ay ang hirap puntahan, ang hirap abutin? Hindi po pala. Because nandyan po ang ating mga local chief executives, sabi nga ni Senator Amy, hindi yan magagawa ng national government agencies, tama po ba? Kayo po na nasa baba ang makakagawa niyan. At hurdling all, the waters, the landlocked, the typhoon, talaga pong naniwala ako. Because I go around the provinces, I go around the different municipalities, Nandito ba si Mayor Eliasar? Nakilala ko pa nga si Mayor Eliasar dahil dun sa pagde-defend natin, Gob, nung congressman ka, dinidefend namin ang Maria Eliasar to be a DOH hospital. Challenging din po yon sa amin ni Gob. Remember, Gob, minsan tumatago ako sa ilalim ng sasakyan, pero nahatak pa rin ako sa Congress hearing. But congratulations, Gov Helen and Kong Helen. We hurdled all the ups and downs and the currents. You hurdled everything. And now it's already a DOH hospital. So tulungan natin ang Quezon Province. At nakita natin, meron na naman tayong bago, yung Southern Luzon, medical school ba yung... Tapos magkakaroon tayo ng mga medical centers. And I fully support the Quezon Province in establishing more DOH hospitals. Sabi po ni Secretary Ted, the target of Secretary Ted Herbosa is to put up DOH hospitals in every province. So tutulungan po namin ang Quezon na mag-improve ang health system. And you have already started that. Kailangan na lang po ng kaunting tweaking natin through the help of our local chief executives. At nandiyan naman po ang ating mga medical hospital directors, yung LGU hospital directors natin. Nandiyan po ang ating mga RHUs, kahit gaano man po kalayo. Nandito po ang ating DMO, si Dr. Juby, si Director Ariel, at saka si Dr. Leda. Sila po ay talagang tuloy-tuloy tumutulong sa inyo dito sa Quezon. Just an information po, nung buhay po si Dr. Hanairo, paborito po niya yung anak ko. Kasi yung anak ko nag-volunteer. Nakilala niyo na ba yung anak ko, Gobelen? Congressman ka kasi noon eh. Sabi niya sa akin, Mami, pwede ba akong mag-volunteer? Kasi hindi siya kaagad nakapasok sa residency sa St. Luke's kasi naglakwat siya muna, nag-abroad muna. Pagbalik niya, sarado na yung ina-applyan niya. So sabi niya sa akin, pwede ba akong mag-volunteer sa DOH? Gusto ko makita what is public health. Alam niyo po, naka 1 year din siya sa Calabarzon. At ang favorite niya talagang province sa Calabarzon is Quezon. Alam niya ni Dr. Juvie. Minsan ninanakaw niya yung aming sasakyan, yung SUV namin. Sabi ko, saan ka pupunta? Gabi na. Ay, may medical mission kami doon. Akala ko, yung medical mission, iiwanan niyan sasakyan sa region at gagamitin yung sasakyan ng region. Yung pala, maghahakot siya ng mga gamot sa mga kaibigan niya, sa kaklase niya, just to provide a medical mission in Quezon. So, hindi ko na siya pinakikialaman kasi nag-i-enjoy siya. So, sabi ko, iba ang enjoyment niya. Kaya sila ni Doc AJ, plano nilang maglagay, kasi rehab medicine siya, plano niyang maglagay, pagkatapos ng kanyang residency, magtatayo sila ng PT and rehab in Quezon. Quezon pang unang-unang probinsya na pili nila. Kaya hindi ko makalimutan si Doc AJ. Kaya sabi ng anak ko, Mami, itutuloy ko yan kahit wala na si Doc Ed. So kaya nung namatay si Doc Ed, siya talagang unang-unang nagpasalamat kay Doc Ed nung namatay siya. So, I think, ngayon na nagustuhan ng anak ko ha, lumaki sa Metro Manila, nagustuhan ng buong Quezon. At hindi ko talaga masukat maisip, nakarating siya ng Humalig, nakarating siya ng Tingloy, aywan ko kung anong-ano. Sa Pulilio nakarating, kahit may bagyo, sabi ko, may bagyo doon, huwag ka nang pupunta. Kaya ko naman, swimmer naman ako, Mami. Imagine. That's why, nung nalaman ko yung anak ko mismo na gustuhan ng Quezon, sabi ko, Gob, kaya pala gustong-gusto ng anak ko. The challenges are there. But now, with the UHC, kayo po ay nagwagi. Nagwagi na po kayo kasi napakaganda po ng ating province of Quezon. So the Department of Health po acknowledges your initiatives to realize the vision of UHC in the Quezon Province, being among the first integrated sites of the UHC that provided the province-wide health system. Our commitment to the PhilHealth Consulta package through the Primary Care Provider Network Sandbox, the implementation underscores our relentless pursuit in ensuring accessible and quality health services for our kababayans in Quezon. At sabi ko nga, kanina narinig po natin kay Senator Amy, ang Quezon ay napapaligiran po ng maraming probinsya. Sabi nga niya, mayayaman na probinsya, Pero dati, mahirap ang Quezon, pero ngayon po, mayaman na kayo. Because of your a very good health system. Yung po ang measure ng kayamanan ng isang probinsya, to have a very good health system. Hindi po sa pera nasusukat. Ang nasusukat po na kayamanan ng probinsya is the way you help our people develop a very good health system of the province. So as we move forward, our focus remains to ensure that no one is left behind with our pursuit of a better health outcome. Our gains serves as milestones guiding us forward. And through our collective efforts, tandaan niyo po to, and through our collective efforts, working hand in hand, we all achieve the universal health care for all. Dito sa kalusugan, kasama po ang lahat. So the Department of Health also aims to ensure that every Filipino achieve the highest level of health by providing a safe, high-quality, and patient-centered services through modern technology. Ayan po, meron na tayong digitalization. And efficient service delivery as prescribed under our Secretary's 8-point action agenda. Alam niyo na po ba itong 8-point action agenda ng ating Secretary of Health, Secretary Ted Herbosa? Meron na tayong mga ibababa. And this is a very good 8-point agenda po, na nakasaklaw na po lahat ng gusto natin maging future ng ating health system in the entire Philippines. Yung pong agenda number 1, ang napaka-importante. Bawat Pilipino ramdam ang kalusugan. Tanong ko po sa inyo, mga taga Quezon, health providers, local chief executives who are the implementors, ang ating mga development partners. Sa tingin niyo po ba sa Quezon, nararamdaman na ang kalusugan? Sa tingin ko po, ramdam na ramdam po ng mga taga Quezon ang kalusugan. Bakit ko po nasasabi? Marami po akong naririnig na mga indigent patients. They are in heart center. They are in kidney center. Mga taga Quezon po, hindi ko man po sila mga kakilala. Lumalapit po sa office ko, hihingi ng letter of guarantee. I never knew them. Pero sa akin po, gusto ko makilala ang lahat ng lumalapit sa akin na nangihingi ng letter of guarantee. Kasi po, gusto ko pong silang interviewin. Sabi ko nga, ngayon nangangailangan kayo ng tulong. Baka later on kami rin ang mga ilangan ng tulong sa inyo. Alam niyo po ba, may personal experience ako. Noon ho ako naadapa sa Jose Reyes, isang vendor ang umakay sa akin at dinala ako sa Jose Reyes Emergency Room. Walang nakakilala sa akin sa emergency room. Basta dinala ako ng mama doon sa emergency room at pinagamot niya ako. Meron lang isang nurse nagsabi, nung nakita yung bag ko, ay, si Asek Laksamana yan. Pero naririnig ko, but I was unconscious at that time. In-interview nila yung mama, kinuha yung lahat ng details and everything. Nung namulat na po ako, dinala ako sa heart center, sabi ko sa staff ko, sino nagdala sa akin sa ospital? Alam niyo ba, what a coincidence, yung mama na pumulot sa akin, pag uwi niya daw sa bahay, sabi niya sa anak niya, di ba mayroon kang sinabi sa akin noon na Doktora Laksamana? Oo, sa DOH yun. Ano ba yun? Paano ba natin nakilala yun? Imagine, yung palang apo niya, ang tinulungan ko sa NKTI for a kidney transplant. Sabi ko, what a coincidence. Tapos, nung pumunta sa pinatawag ko talaga. Sabi ko, Manong, maraming salamat at kung hindi dahil sa iyo, nag-bleed na ako kasi meron akong laceration. Hindi ko po alam, basta't nung nakita kita, tumayo lang din ako kasi vendor eh. Sabi ko sa mga staff ko, so next time, always know the people that you are helping. Kahit na hindi mo kakilala, kasi kinilala ko po talaga, kasi ang lakas ng dibdib ko na kilalanin siya. Kasi, yung tulong na binigay niya sa akin is something that I cannot forget. At yung palang tulong na nabigay ko sa kanila, hindi man nila ako nakikita personally, is something na nakatatak sa kanila. So sabi ko nga, bilog ang mundo. So sabi ko ngayon, because of the Universal Healthcare Law, dati po, nasa baba tayong lahat. Ngayon, because of the UHC, we try our very best to give everything to our constituents. So nakita ko po kay Governor Helen Tan, ang aspirations niya to make the UHC work in every province. At kayo po ang model, sabi ko kay Governor Helen, kayo na po ang magiging model natin ngayon. Ginagaya na po ang ginagawa ninyo sa ibang probinsya. You have surpassed other provinces. So congratulations po again to you, Gov. Helen, and to your mayors, vice mayor, and our health workers, and even our development partners. So in closing, I extend my deepest gratitude to each and every one of you for your unwavering dedication, resilience, and passion in championing the cause of health for all. Through our hard work, commitment, and service, we can ensure a stronger health system for every Filipino towards the realization of a healthy Pilipinas kung saan bawat buhay ay mahalaga tungo sa bagong Pilipinas. So congratulations again, Gov. Helen, to our local chief executive, Vice Gov, congratulations po. At ang ating mga mayors, vice mayor, saludo po kami sa inyo with the help of your local health workers. Of course, nandyan lang po kami. Nandito lang po ang opisina ko, ang Special Concerns Office po. Kung any special concerns na alam ninyong hindi nyo maika-classify sa anong cluster sa DOH, sa akin nyo na lang po ilapit. Because special concerns is really very special to my heart. So maraming salamat po. Gov. Helen, thank you very much for the invitation to us, to the central office. At alam ko, magagalak ng husto si Secretary Ted Herbosa to attend the future activities of Quezon. Kasi po, nasabi ko po sa kanya 2 weeks ago, nung pinag-uusapan ng Quezon, hindi ko alam na may activity na ganito, napag-usapan po namin ang Quezon. So thank you very much, Gov. Helen, for the opportunity to stand here before you and really share my thoughts about the province. So thank you again, and may we have a very productive more years to come to achieve our universal healthcare aspirations. Andyan ang ating very lovely and proactive governor. My support is with you, Gov. Helen.
Undersecretary Laksamana, thank you so very much. Please remain on stage. Truly, the strong partnership between the Department of Health and the province of Quezon is most critical in improving and developing Quezon's health system. The province of Quezon would like to present this plaque of appreciation to the Department of Health for your support and partnership with the province of Quezon. Mga kaibigan, Undersecretary Dr. Maria Francia Misiano Laksamana. Well, ladies and gentlemen, good news, the food is ready. But before that, the Universal Healthcare Law is the fruit of decades of labor and advocacy of our policymakers. From the health system fragmentation brought about by the local government code in 1991, we are now moving towards a coordinated and integrated provincial health system. With its ailing socio-economic conditions, inundated health infrastructure, and the wide gap in human resources for health, it has been daunting for the province of Quezon to even commit into the health system integration. Pero kay Dr. Helen Tan, hindi pwede ang pwede na. Hindi sapat ang okay lang. At hindi katanggap-tanggap ang basta ay may maibigay. Our people deserve the best. It is only with our dear Governor's commitment, initiative, will, and push to our component local governments that the province-wide health system integration has been possible. To share with us the future directions of the province in the implementation of universal healthcare, please welcome the Governor, Angelina Doctora Helen Tan.
Thank you so much. Maraming salamat po. You may take your seat. Ito yata yung pinakamahirap na parte ng program, yung kahulihan ka magsasalita, tapos gutom na kayo lahat. No? So, very challenging. Anyway, wala po akong pinrepare na speech. No? So, I'll be quick. Hindi po ito tungkol sa akin ng gabing ito, kung hindi tungkol sa inyong lahat, sa lahat ng ginawa natin. Mabilisan. Vice Governor Third Alcala, our partners from the DOH, supposed to be Sec Ted Herbosa, ang ating one of the guests, but we're thankful, Yusek Francine Laksamana, ARD Leda Gonzalez, Dr. Juvie Porino, our Provincial Health Officer, Dr. Tin, together with Dr. Lorelai, Dr. Chris, and all the staff of IPHO. Of course, our strong partners, our mayors, through the leadership of Mayor Rachel Obana, our LMP President, our Vice Mayors League, nandyan din po sila through the leadership of their President, Vice Mayor L.A. Ruanto. We have municipal councilors, our municipal health officers through their President, Dr. Ronald Mararak. Okay? Our medical center chiefs, nandito po ang mga chief of hospitals ng 15 hospitals natin. Hindi ko na po kayo i-recognize. We have all the healthcare workers and the development partners. Our partner Apex Hospital, nandito po ang East Avenue Medical Center. Dr. Troy Bakir. We have Dr. Wanching Magnaye, ang atin pong director ng Batangas Medical Center. And a while ago, nandito po ang representative ng Rizal Medical Center, si Dr. Francisco. I think he left na. Partner natin na Dr. Mavi sa ating eye program, Fred Halos. Thank you sa inyo pong lahat. Magandang gabi. Kung may nakalimutan po ako, pasensya na po. No? I would like to thank Dr. Tien for this effort po. Actually, siya po nag-conceptualize, nag-recommend. Palakpakan naman natin si Dr. Tien. To have this Quezon Health Summit and recognition of our best performing LGUs, MHOs, and our program managers. So mamaya po, I think, hindi pa ninyo alam kung sino yung mga makakatanggap yata ng awards, but congratulate ko na po kayong lahat. Moving forward, what do we expect, no? Na-mention, ang ganda na po ng message kanina ni Mayor Rachel, na i-share niya sa atin yung struggle of the LGUs, which also a struggle din ng provincial government, and expectations ng ating mga local chief executives doon sa kanilang pakikiisa through the integration. No? Senator Amy Marcos shared her insights on, as a legislator and a former local chief executives, ano pa ang mga dapat gawin natin so that we can achieve universal healthcare law. Si Vice Gov shared the initiative of the Sangguniang Panlalawigan aligned with the health priorities of the Quezon Province. So, mabigat ang expectations, no? At ang pinakamahirap is managing expectations coming from you, our partners, and the people of Quezon. No? So, sabi nga ni Yusek Laksamana, tinitingnan, at sabi ni Doc Monching, tinitingnan ng lahat ang Quezon. No? Hindi ko naman to ginagawa dahil ako ang principal author of Universal Healthcare Law. But when we crafted Universal Healthcare Law, yung pangarap ay pangarap ko bilang isang Pilipino. No? At syempre, dahil nagsimula yung pangarap na yon bilang isang Pilipino, kung gusto nating ma-experience at maipadama sa kapwa Pilipino, unahin natin sa sariling atin, no, sa Quezon. So malayo pa ang ating lalakbayin. Ang health facilities natin kulang na kulang pa at alam natin kung gaano kabigat ang pondo na kailangan. Our upgrading of these health facilities kasama ang health human resource. Alam natin very challenging sa mga LGUs yung creation of plantilla because of the PS cap, no? So ang daming hamon, but we're doing some strategies and kahit po hindi na ako nasa Congress, I'm still using my influence being a former member of Congress by pushing the leaders, no? Sa pamamagitan ni Secretary Ted, Chairman of the Committee on Health in Congress, Chairman of the Committee on Health in Senate, and other legislators, na sana ay ma-improve natin kasi hindi natatapos sa UHC law lahat, no? Ang daming mga gray areas in the implementation at alam natin na hindi natin kakayanin na mag-isa. So, what we want to do is to continue our partnership, no? Sana walang susukong mayors at bibitaw sa ating integration and network, no? Yung katulad ng sinabi ko kanina, ang hirap i-manage yung expectation sa akin personally, no? Being the leader, no? O ina ng ating lalawigan at bilang doktor, no? More of nakikita ninyo as ako as a doctor. That will be able to provide the all the necessary requirements para maramdaman ng mga Quezonian yung kalidad na serbisyo ng kalusugan. At sinimulan na po natin yan. At yun din ang aking hinihiling palagi sa ating mga partners, the MHOs, and the Chief of Hospitals. No? Kasi dito po dumadaan lahat ng mga nangangailangan ng serbisyong pangkalusugan. Kaya, rest assured that the budget, especially the Special Health Fund, is properly allocated and will be properly used, no? At lahat naman ng alokasyon ay dumadaan sa ating local health board. Transparent naman tayo doon sa ating paggasta. Okay? Doon sa strengthening of the primary health care, we really need your cooperation kasi ito yung gusto nating i-champion. Kung narinig niyo po ang sinabi ni Senator Amy on the healthcare system of Costa Rica or Paraguay, yan po ay yung nag-transition sila from the curative to primary healthcare. Preventive po sila, no? So, kung titingnan, yung investment nila sa health, kung tingnan sa Pilipinas, doon sa output, makikita po doon na mas effective talaga kung bibigyan natin ng mas malaking pondo yung preventive aspect, no? So, yun po ang direction ng Quezon Province. That's the reason why tayo po ang kasama doon sa Consulta Sandbox. Maraming challenges. Di ko na isa-isahin. Alam po ng mga implementers to, ng ating mga MHOs and Chief of Hospitals and all the healthcare employees natin, no? But hindi tayo susuko until we achieved yung goal natin that wala pong Quezonian ang mawawala sa sistema pagdating sa kalusugan. Which means, kung may maramdaman siya, may accessible sa kanya na facility. Kung hindi available sa facility, may pupuntahan siyang higher level na facility. Ganon din, may dapat titingin sa kanya. At kung kulang ang PhilHealth coverage, merong pondo ang local government na nag-augment doon sa kinakailangan niya. May not be enough, but at least naramdaman niya na bumaba yung out-of-pocket niya because of the provision of assistance coming from the local government, no? When it comes to healthcare workers natin, nag-devise na po kami ng strategy. Nag-start po tayo ng full scholarship with return of service program. Okay? Eto, pupunta din po ito sa inyo. Kung hindi namin kailangan sa mga health, sa mga hospitals, pupunta po ito sa mga rural health units natin. Next year, meron po kami for every barangay na health navigators, no? So, mag-hire po ang provincial government ng health navigators so that makapag-assist sa ating mga MHOs, okay? So, yun po yung direction natin to fully implement yung primary care while we are upgrading our hospital facilities and strengthen natin the patient navigation system. I think kung magawa natin to, together with the telemedicine, no, that we are still crafting in partnership with QMC and other Apex Hospital, okay? And lastly, that sana the specialty hospital will be close to Quezon, no? Hindi na pupunta sa Maynila. Senator Amy mentioned about the recently enacted law on the establishment of the Regional Multi-Specialty Center. Gusto ko pong sabihin sa inyo, bago pa po nila ginawa yan, nauna na po tayo sa Quezon. Before po ako umalis ng Congress, I made sure that the Southern Luzon Multi-Specialty Medical Center will be enacted. And it was enacted already and ongoing po ang construction and still tumutulong ako sa DOH to find fund. Sana dapat problema na nila ito, pero imagine nyo po na naglalakad pa ako sa Senado para lang po may magpondo ng sa construction nito. Siguro I hope, ARD Leda, pakisabi sa RD natin and USEC Francine, nandun na yung batas, ang kailangan lang ay pondo galing sa inyo because this will be operated under your direct control and control. Okay? So sa inyo po yun. Yung supervision po, sa inyo po yan. So nandun na sa Quezon, we already have Maria Eliazar General Hospital as DOH retained hospital also. And recently, na-pass po sa Congress yung renationalization of QMC. Ayoko po sanang ipa-renationalize to because of all the efforts that we are doing, pero para po matulungan naman namin ang other district hospitals and maging accessible sa lahat ng Quezonian. Alam niyo po, pag dumating sa Lucena, lahat po ng Chief of Hospitals, kung nagrereklamo kayo, bakit po ang tagal ng response nila, totoo pong punong-puno doon sa kanilang emergency room. And yung capacity talaga, may hangganan, no? So the strategy is to increase the service capability of different district hospitals so that our constituents naman po na nasa pinakamalayo like San Andres, Humalig, pag pumunta po ng Infanta, ng Polillo, ng Bundok Peninsula, San Narciso, Onisan, may serbisyong maibibigay tayo at hindi laging ililipat natin papunta sa Quezon Medical Center. So, yun ang dahilan kung bakit gusto nating i-renationalize ang QMC so that the fund na atin pong ginugugol doon ay mapunta sa mga district hospitals. Nilagay po namin sinasabi, puro Taga-Lucena po ang gumagamit ng QMC. Kaya kami po ni Doc Tin at saka ni Doc Jeff ay panayang apela sa Taga-Lucena katulad ni Vice Governor Third Alcala. Hayaan nyo. Sabi ganyan eh. Na ma-pre-off po yung bed kasi puro mga Taga-Lucena, no? In time. In time po. On the right time. Alam ko. And then, what else? We are now partnered with the private hospitals. Okay? So, hindi kaya talaga ng gobyerno. Hindi po namin kaya lahat ibigay. Hindi po namin kayang bumili ng CT scan at mag-operate ng CT scan. Kaya po sinasabi ko sa mga mayors na gustong magtayo ng ospital, pag-aralan nyo pong mabuti because it's really, really hard to operate a hospital. Ang kailangan natin is pagtulong-tulungan kung ano ang meron dyan. I-upgrade yung level na meron po sa inyong lahat. So, sa inyo pong lahat, congratulations kasi naabot natin yung milestone na to. Integrated, naka-network po ang healthcare provider network tayo. And then lahat po ng ating mga LGUs ay nag-integrate with us. So, challenge sa mga MHOs, please, para hindi po ma-disappoint ang ating mga mayors dahil kasama po kayo dito and also our Chief of Hospitals. So, congratulations po sa makakatanggap ng awards later on. And babatiin ko na kayo ng advance Merry Christmas. I don't know kung magkita-kita pa uli tayo before Christmas, but thank you, thank you, thank you, thank you so much for all the hard work, for your partnership, for the support, for your commitment, lahat po ng magagandang adjectives na gusto kong sabihin. Hindi tayo makakarating sa kung anong meron tayo at hindi natin maririnig ang magandang sinasabi. Kwento lang ni Doc Monching. Hindi siya taga Quezon, but may nakakausap siya from Quezon. It's all because of you. Yun po ang dahilan. Palakpakan naman po ninyo ang inyong mga sarili. Maraming salamat po. Magandang gabi po.
Ladies and gentlemen, Quezon's Pride, ang ating pong minamahal na Gobernador, Governor Dr. Helen Tan. Alright, at this point, well, Governor, what you've talked about is very reassuring. No, for all the people of Quezon, maraming salamat at mabuhay po kayo. And at this point, we are now opening the buffet. So please, our staff and coordinators will be approaching you per table. And then once you're approached, you may...